What if your survival depended not on doctors, but on dirt bark and instinct? What if every wound was a gamble between life and death, and the only hospital was the forest itself? Long before syringes, antibiotics, or surgeons, our ancestors faced illness, injury, and infection with nothing but raw nature. How did they heal, and what did they lose or preserve that modern medicine has forgotten? A storm has passed. The canopy above still weeps droplets of yesterday's rage. Beneath a wide slab of stone, dark and cold, the clan stirs quiet, cautious. Among them lies a man, his leg twisted and swollen, the skin darkened and tense like a drum stretched too tight. He does not cry out. He breathes through clenched teeth, his face carved in pain. A broken femur, perhaps caused not by war, but by fall. The kind of fall that today would send you to an emergency room. But here, 5.1 million years ago, there are no white coats, no sterile lights, no morphine. Two women crouch beside him. One is older, her skin creased like old bark, her eyes deep with knowing. The other, younger, watches and mimics. The older woman places a thick, bitter-smelling paste-crushed leaves, moss, and insect husk directly onto the wound. Her fingers move with certainty. She wraps the leg tightly in strips of sinew and plant fiber. The man's jaw trembles, but he does not move. This is not medicine as we know it. This is survival, encoded in ritual and memory, in the silent transmission of knowledge passed hand to hand, wound to wound. Elsewhere, a child coughs through the night, harsh, wet, and erratic. A fever grips his small body, and the mother's eyes flicker with helplessness. But the clan does not panic. A fire is fed until it glows like the sun. Stones are heated and wrapped in fur pressed gently to the child's chest. Smoke from burning roots curls into the air, aromatic and sharp. The child breathes it in. It may soothe, it may not. But it is all they have, and sometimes it works. Healing in this world is not a service. It is an instinct. Pain is not eliminated, it is endured. The body is not saved, it is tested. There are no guarantees. Every scratch can rot. Every breath can turn sour. The line between life and death is drawn thin and walked daily. But still, they endure. And not just through biology, but through care. A fractured leg is carried, not abandoned. A sick child is comforted, not left behind. Survival is not individual. It is collective. In the raw silence of prehistory, healing is not science. It is solidarity. A leopard's distant cry breaks the quiet. The women freeze, then move as one. The fire is dimmed. The injured man is shielded. The night presses in. But so does the will to survive. Dawn does not arrive gently. It pierces the forest like a spear of molten gold, dragging shadows back into their roots. The clan awakens their bodies sore, but their circle unbroken. The man with the broken leg lies still, his breath shallow but steady. Around him, the scent of crushed herbs and sweat thickens the air. Healing here is not marked by charts or progress notes. It is marked by stillness, by eyes that open, by wounds that do not stink. Two adolescent boys return from the stream carrying a carved wooden bowl brimming with cloudy water. The younger crouches beside the injured man, dipping a wadded bundle of fibers into the bowl. He presses it against the man's forehead, copying what he has seen. This is his first lesson in medicine. There is no school, only watching, repeating, remembering. Far from this camp, modern medicine would call this primitive. But this ritual, this silent care passed through gesture, not language, is older than any oath sworn in marble halls. Their treatment is not about eradicating symptoms, it's about surviving the day. Then the next, then the next. And that's enough. The matriarch inspects a series of marks carved into a bark wall. They are not letters, but symbols, etched impressions tracking sickness, births, deaths. A memory not kept in minds but in tree flesh. She scratches a new mark beside the others, a curl resembling a leg split. It is both a warning and a prayer. A woman with a swollen abdomen, heavily pregnant, sits quietly on a stone near the edge of the shelter. Her face betrays nothing, but her hands clench leaves in a fist, pressing them into her palm rhythmically as if to anchor herself. Birth is close. There is no midwife, no antiseptic, no scalpel to slice skin if the baby turns wrong. Only instinct, pain, and chance. In a modern hospital, dozens would gather. Machines would blink. But here the only tools are breath and bone and patience. The clan moves slowly that day. They do not hunt. Their strength is focused inward. Even the fire burns lower. Every ember is precious. Every moment of quiet is a seed for the next hour of survival. From the tree line, a child returns carrying a branch of wild berries. Some are crushed, some are green. But among them, the old healer finds one she recognizes, a pale purple pod used to stop bleeding. She smiles faintly, not because she trusts it, but because she remembers it worked once years ago on another child, another wound. That is how knowledge lives, in fragments, in whispers, in memories, held not in libraries but in scars. And when the sun begins its descent, and the shadows lengthen again, the man's eyes flutter. The swelling has not worsened. The fever has not returned. In this world, that is not recovery. That is a miracle. Night returns not with peace, but with questions. The sky hums with unseen life. Insects thrum like drums from another world. The wind shifts, bringing the scent of damp earth and animal musk. The pregnant woman has begun to groan softly, her body drawn into itself like a coiled spring. The elder woman kneels beside her, not to command, not to instruct, but to accompany. There are no words exchanged, only breathing, only touch, only presence. The men form a perimeter with sharpened branches, watching the forest with eyes that burn red from smoke and fatigue. Danger does not pause for birth. There is no room for weakness in the wild. But in the heart of this storm of uncertainty, something ancient pulses the will to bring forth life despite death's proximity. The birth unfolds like a ritual, not a medical procedure. The woman leans against a stone, gripping its cool surface. Blood stains her thighs. Her screams are swallowed by the trees. And then, suddenly, utter silence. A stillness so profound it seems time has stopped. Until a thin, wet cry cuts through the dark. New life. The newborn is lifted slick and trembling. The cord is bitten, not cut. The placenta buried beneath the fire pit, an offering to earth. The baby is pressed against its mother's chest, both their bodies steaming in the cold night air. No measurements, no name, only breath, only life. Elsewhere, the injured man sleeps with fewer tremors. The boy who watched over him now sleeps curled at his side. The healer, exhausted, traces marks in the dirt, a spiral, a jagged line, a circle. Not art, not superstition, but record, a ledger of survival. And yet, healing is not always victorious. Beyond the clearing, another child has begun to shake violently, his skin too hot, his lips cracked. The mother weeps in silence, rocking him beside a fire fed with medicinal bark. But it is not enough. The fever does not break. She presses a woven talisman to his chest, as if to barter with nature itself. But there is no transaction here. Only chance. Only consequence. By dawn, the boy is still. The clan gathers not to wail, but to hold. The mother cradles him for hours, unmoving. When the sun reaches its highest point, the body is wrapped in vines and carried to the river. The clan walks in silence. No grave, no marker, only water to carry him forward. This is prehistoric healing, a world where every act of care is balanced on a blade, where memory is treatment, where nature is both pharmacy and threat, where life is always outnumbered by the unknown. But even without antiseptics or machines, these people do not yield. They bandage with leaves. They diagnose by smell. They treat with fire and patience. And above all, they do not abandon their wounded. Because healing for them is not fixing, it is standing beside. Until the body either returns or does not.